This topic is not from the textbook, okay? Just additional classes that we are taking. Obesity. So if anyone joins late, please help them out with the topic name. So obesity is commonly defined as having too much body mass. Okay. In If you want to calculate it, do you come under the category of obesity or not? The general calculation that we use is the BMI. Okay. BMI just gives the relationship between your height and weight. Okay. It will not give you further than that. What is your fat mass? What is your muscle mass? Fat percentage, muscle percentage. Okay. These things needs to be calculated. Okay. You can do a DEXA scan as well. So that uh, to that depth, BMI will not give you an answer. It will just give you a basic statistics of are you in a category of obesity or not. But still that is in some situations it is quite contradictory. Okay, like for example athletes and all, they have a really good muscle mass and very less fat mass, but still they are healthy. Okay, but if you check their BMI, it will show about 25. Okay, but they will not have the other predisposing factors of some chronic inflammatory diseases what the general population with the same indices of BMI may have. Okay, so BMI of 40 or higher is considered severe form of obesity. Okay, it was earlier called as morbid obesity. Now it is just severe form of obesity. Childhood obesity is measured against growth charts. Okay, we usually don't use BMI for children. There is growth chart that you have to monitor. Okay, till the age of 5, there is under 5 growth chart. Okay, in different states, if you visit government facilities, you will find it as Thai card, I card, okay, Amma card, and all. There are different names for it. Not just the child's health, but other also mother's health is also recorded. Okay, so that is one growth chart. Then we have other growth charts from WHO as well. For girls and boys, there are different growth charts. Okay, so if the child is either going into the state of malnourishment or the other extent of obesity, okay, either ways, okay, there is a healthy pathway through which a child should travel through when you're monitoring their height and weight. Okay, if they are going too steep or too low, both is considered unhealthy. Okay, so childhood obesity we use growth charts for to measure it out. So what is obesity? Okay, obesity is a complex chronic disease, okay, with several causes that can lead to excessive body fat and also sometimes poor health. Okay, too much of body fat in women, usually if you have a fat mass which is more than 32% or 33%, okay, you come under the category of being overweight and obese. Okay, at least a healthy woman should have at least 22% body fat. Okay, at least 20 to 22% body fat should be there in a healthy woman's body, especially women who are in their reproductive age group. Okay, they should have at least 22% of body fat so that they get regular periods. Okay, fat is required in your body to make hormones. Okay, cholesterol from fat is required for hormone production. If you don't have enough fat, you will lose your hormone production and it will lead to amenorrhea and all. Okay, absence of menstruation. Okay, so body fat itself is not a disease, but the amount of body fat that you have, that could signify your chances of getting certain diseases. Okay, but when your body has too much of fat, It can make your body inflammatory. Okay, it can lead you towards some inflammatory disease conditions, and they are progressive. Okay, you don't get fat within a day, you don't get fat within a week. Okay, over and over having the choice of overeating, okay, lack of physical activity, that's a choice that we make. Okay, it's not that you become fat overnight just by having one tablet or just by overeating just for one day. These things won't make you fat. Okay, but it's a when it becomes a daily choice, a habit, that's when there is an issue. Okay, am I audible to all? Is my voice clear? So again, when it comes to the changes that obesity can bring, it can worsen over time. Usually, inflammatory diseases can worsen over time. They can also lead to some adverse health effects as well. For example, some metabolic diseases like type 2 diabetes, chronic vascular disease, cardiovascular diseases, fatty liver, nephrotic diseases, gallstones. Okay, these things can come slowly, okay, progressively. Other functional effects, people who are overweight or obese, okay, they have issues with asthma, breathing difficulty, sleep apnea, not able to breathe properly while lying down. Okay, when you lie straight on the bed without elevating your head, okay, you can't breathe properly. That leads to sleep apnea. You require at least a slight cardiac position while sleeping. Okay, then obesity hypoventilation syndrome, just climbing a flight of stairs or brisk walking for even for 5 minutes, okay, they can hypoventilate. They will sweat a lot. Okay, their heart palpitations will be high. They will breathe a lot. Okay, so that is hypoventilation. Osteoarthritis, usually it happens at your weight bearing bones. Okay, your pelvic bone, femur, ankle. Okay, these bearing bones, they will undergo arthritis, osteoarthritis, inflammation at the joints of your weight bearing bones. Okay, back pains, gout. Okay, gout, it's a metabolic disorder. Too much of uric acid that accumulates in your body, too much of uric acid that is not passing out of your body through kidneys. Kidneys have to take away uric acid out of your body. Okay, so when kidneys are not functioning properly, this can happen. Uric acid will get deposited near your joints, near your bones, and that will cause inflammation. Okay, so these are the direct indirect effects of obesity. Is it clear to all? Then, is obesity defined by your weight? Again, fitness, when I ask you to imagine a person who is really fit, okay, automatically your bones, your mind will feed you the image of a woman or a man who is ripped, okay, who's very muscular and all, okay. So fitness is not always that, okay. You can be healthy and fit at any given weight. Okay, there are not particular body indices that you should be of this height, you should look like this in a certain way, only then you can be fit. Right now the Olympics are also going on. If you are catching up with the news, if you see the female athletes, and female athletes especially, okay, they don't have a supermodel kind of a body or something, but still they are medically fit, physically fit to represent the nation in Olympics. Okay. So that is what fitness is. So obesity is not defined by your if you may be a 70 kg weighing woman, okay, or 75 kg weighing woman, but if you have a specific height and you have a specific body fat mass, your body fat mass is at just 31%, but 29%, okay, and you are 75 kg in weight, you are still fit, okay. So usually BMI is a very, why BMI is so famous, it's very easy to calculate. Anyone can calculate this. Okay, and it does not require complex calculations. Okay, so it's a simple calculation that we use in BMI. So healthcare providers usually use body mass index to define what obesity is, but in general population, it's very it's very generalized kind of a calculation, BMI. So it measures your body weight, okay, in respect to your body height. Okay, just height and weight. These are the only things that we use in BMI. And generally we say a BMI of 30 or higher means the person is obese. It has its limitations because uh, even though it can help you to identify, are you at risk of developing certain disease condition, okay, but there are certain limitations to it. Not everyone who has a BMI of 30, 31 is at a risk of cardiovascular diseases, okay. So BMI has its regulation, okay. So examples of limitations are like bodybuilders, athletes, they have more muscle mass, okay. Muscle mass, it may look very less, but it weighs much, okay. If you take a 5 kg lean muscle and a 5 kg of fat, okay, just by looking at the sheer proportion of both of it, okay, the muscle, 5 kg muscle could hardly be one fourth or half of the size of that 5 kg of um, fat, okay, fat mass. So that's how muscle, even if it looks quite less, but it is quite heavy, okay, lean muscle especially. So bodybuilders and athletes, they will have a BMI that is quite high because their fat levels are low. And even if you are of a normal BMI or a normal body weight, you can still be obese, okay. If your average body weight uh, and average body fat percent is high, you will, even with low BMI, you will have the same health risk, okay. For example, let's say your BMI is 24 or 25, you are in a healthy category, you are not even in the overweight category, but your body fat mass is quite high, okay, you will have the same health risk. This happens in Indian, okay. Majority of Indians are not that obese. They are skinny people. Okay, they have less height. They are not that much in weight, but whatever weight they have, majority of it is made up of fat. Okay, so that again puts them at the higher risk of developing cardiovascular diseases, diabetes, and all. So, what are the three types of obesity? According to healthcare providers, obesity can be classified into three types based on its score. Okay. So if you are between 25 to 29.9 kg per meter square is the formula for BMI. So you are in the overweight category. Now, about 25, sorry, about 29.8 when 30 starts. Okay. you have three different categories of obesity: 30 to 35, 35 to 40, 40 and above. Okay. 30 to 35 is class 1 obesity, 35 to 40, class 2, 40 and above is morbid obesity, class 3 obesity. Okay, severe forms of obesity. And based on these BMI, certain weight reduction treatments can be given. Okay. For class 1 obesity and all, you don't have to go through too much of gastric bypass surgery and all. Okay, even to qualify for gastric bypass surgery, you should have certain obesity. You should come under certain class of obesity. It's usually done for people who are in class 2 and class 3 obesity. Gastric bypass surgeries are conducted. Okay. Worldwide, obesity has nearly tripled in the last 50 years. And usually in the lower income countries where malnutrition is common, but still obesity has also tripled there. It's because of the accessibility of food. Okay. And also in the past 50 and 100 years, uh, when they discovered fertilizers and all, okay, that's when the population also doubled, tripled. Okay. Before that, the population was under control. There was not overflow of food and all. Okay. During the 1950s and all, 1950s, 1960s in USA, there was extreme production of food and they needed to get rid of too much of food. So if you see the portion sizes that they get in USA and all, it's quite big. Okay. Because there was the economic boost was seen in USA in 1950s, 1960s and all. And also because of migrating population, globalization, even lower income countries, those who have accessibility to food, accessibility to money, okay, upper classes, upper middle classes, the risk of obesity doubled in lower income countries as well, even though there is malnutrition. Okay, but there is, when it comes to lower income countries, it's usually associated with polarization. Okay, not much people are somewhere in the middle. People are on the extreme end. Okay, either politically or even when it comes to the division of money, class wise also, it's either on the two ends. So these communities which now has greater access to high calorie food but with low nutritional value. Okay, this is the common food that is associated with obesity. Okay, calories are too much, but there is not much nutritional value to it. They are not nutritionally dense. They are calorie dense, but not nutritionally dense. So obesity now commonly exists under nutrition within these countries, lower income countries. So along with obesity, malnutrition, undernutrition, both the cases are seen in the same country. Then coming to metabolic changes. So when you usually run out of tissue to store lipids in your body, okay, when you start putting on weight, when you start becoming overweight, okay, what's happening here is more fat is incoming, but there is not enough adipose tissue to store this fat. Okay, but adipose tissue cells have this characteristic that they can just expand and expand. Okay, they can become really large. So existing adipose cells, they will become enlarged. Okay, but there is a drawback to this enlargement. The more it spreads and it becomes enlarged, it is able to secrete hormones. Okay, and also other chemicals. It will release other chemicals which can also lead to inflammatory responses. That's why obesity is associated with inflammatory disease conditions, chronic inflammatory disease conditions. Okay. So women who are obese, the fat cells, these enlarged adipose cells will produce testosterone. Okay. Men who are obese, their enlarged adipose cells will produce estrogen. Okay. Like some amount of estrogen is present in men, some amount of testosterone is present in women, and in a very minute quantities. That is normal. That should be there. Okay. For men, it helps them with their cardiac health, anger issues. Okay. For women, little bit of testosterone that their body is producing at a normal rate will help in sexual drive, okay, in energy requirements and all. Okay, but the problem starts when you become obese. Okay, the amount of opposite sex hormones produced within the individual, when it becomes too much, there is too much of production of this opposite sex hormone, it will create fundamental hormonal changes. Okay, so chronic inflammation will have adverse health effects. It will affect all the areas of your metabolism. Usually it starts with diabetes. Diabetes is also an inflammatory disease condition. Okay. So what happens here? Your body is not able to use insulin when you are in an inflammatory situation. Okay. Your pancreas are secreting insulin, but your cells are not responding to insulin. Okay. So it lowers your blood glucose levels. It will also uh, increase your blood cholesterol levels, sugar and fats in your blood. Okay, that will get affected because cells have to respond to insulin. Only then the cells will be able to take in glucose, take in fat, and do its job of releasing energy. If cells cannot respond to insulin, how will the glucose get inside the cells to give energy? How will the fat get inside the cells to be broken down and give energy? Okay, that will not take place. So high blood sugar and blood lipids, uh, high cholesterol levels, hyperglycemia, these things are associated with metabolic changes of obesity and also high blood pressure. Okay, because the contents in the blood is quite high. Too much of plasma, too much of sugar, too much of fat, the contents are quite high. So your that high content of your blood, the volume of that blood, it will definitely exert pressure on your blood vessels. So automatically, progressively, blood pressure issues will also develop. High blood pressure issues will develop. Okay, so at a biological level, these are the changes that are taking place in your body. So coming to the diseases, which all metabolic diseases will obesity bring? First is type 2 diabetes. We all know how obesity is associated with type 2 diabetes. It is the risk is sevenfold, 7 times in men, okay, and 12 times high in females. And as your BMI increases by 20%, every time your BMI increases by 20%, the BMI increases by the risk of getting diabetes increases by 20%. Okay. For example, uh, your BMI was 24. Now your BMI is 25. There is 1 point increase in the BMI, but the risk of developing diabetes has increased by 20%. Okay. And also, when you control your weight, when you are on weight management program, weight loss program, your risk of developing diabetes also goes down. Okay. So before you become pre-diabetic, or even in the stage of pre-diabetes, if you're doing your weight management properly, the risk of developing diabetes will step back. And cardiovascular diseases, high blood pressure, high cholesterol, high blood sugar levels, okay, all these will cause inflammation. Okay, and inflammation can happen anywhere, at your arteries, in your heart, anywhere inflammation can happen. Anywhere this excess cholesterol can get stuck and cause blood blockages, because too much of cholesterol is there in the blood. Cholesterol is not able to get inside the blood. There are too much of cholesterol outside the blood. Okay, some in some way or the other, the cholesterol has to go inside the cells. It's not happening, so they get stuck in the blood vessels and they create blockages there. Okay, and cardiovascular diseases, because of obesity, is the leading cause of preventable death worldwide. Okay, even in India. Then you have fatty liver disease, excess of fat circulating in your blood that can also make its way into your liver, because your fat needs to go somewhere. If not into the cells, it has to be deposited somewhere. Some part of it, some cholesterol will get stuck in your blood vessels, but the major part of it will go to the liver to be stored. So when it surpasses the normal limit to which liver can store fat, that's when hepatitis will begin. Okay, because hepatocytes are the cells of your liver. They have a capacity of storing fat. Okay, but when it exceeds, when the storing capacity, the amount of fat exceeds the storing capacity of hepatocytes, it will cause liver inflammation. It will damage the cells. Okay, and if hepatitis is not treated at the right time, it will lead to long-term liver damage called liver cirrhosis. In liver cirrhosis, what happens is that the tissues that are storing fat, that are storing excess amount of fat, that will get damaged, and in that damage, it will become a scar. Okay, so liver damage or liver cirrhosis means there are a lot of scars in your liver. Okay, and these scarred areas, these scarred tissue areas will not be able to function properly. You can see it on your body, whichever body part you have a scar on, even on your skin. Okay, wherever you have a deep scar or a small gash scar, okay, you will see that area does not sweat, does not produces any sebum. The function is lost. Okay, the same thing happens in your organs as well. In whichever part of your organ there is a scarring, okay, that area will not function. So just imagine 70 to 80% of your liver is scarred. There is scar tissue in your liver. That 70 to 80% of your liver is damaged. It cannot function. And liver has to produce so many enzymes, hormones, okay, which are important, necessary for your survival. Okay, so that functions will also get altered and it usually leads to death. Okay, a lot of liver cirrhosis cases, final stages, you cannot save the patient. Okay, then kidney diseases, high blood pressure, diabetes, and liver diseases are very common reasons why a person may have kidney diseases. Okay, they go hand in hand. Anything wrong with your heart kidneys will get affected. Okay. Gallstones as well, I have discussed it earlier. With obesity, the risk of developing gallstones is high because now your liver is producing high concentrated bile juice. Too much of bile is produced by the liver. Okay, bile juice is produced. Highly concentrated bile juice is produced, and that will go into your gallbladder and will be stored there for some time. Okay. And when you are obese, your liver wants to produce more concentrated bile juice. It is stored in the gallstones, gallbladder. The more concentrated your bile juice are, the high risk of it becoming crystallized. Okay. Concentrated liquids, they easily become crystallized. They become stone. Okay. So that's how gallstones will develop. Okay. Coming to direct effects, so far is it clear to all? Direct effects. Excess of body fat can get deposited around your organs. Okay. Your lungs, your pancreas, your intestine, okay, your liver. Majority of your vital organs, they naturally have this layer of fat around them. Okay. That should give them enough cushioning effect so that blunt traumas will not damage your bones. Sorry, trauma will not damage your vital organs. That's why we have a cushion layer of fat around our vital organs, okay, for protection. But this visceral fat, this is called visceral fat, okay. But when the deposition of this fat surpasses the normal level, there is too much of fat around your vital organs. And that can just imagine, okay, if there is too much of fat around your lungs and over the period of days as it goes by, okay, the layer just increases in its size. Definitely, your lungs will feel the pressure, right? Anything around you which is supposed to just if you are putting one blanket on you and imagine you are putting five blankets on yourself, definitely you will get compressed under that pressure. Okay, you will feel suffocated. The same scenario happens here as well. When the fat around the organs increase, okay, in their volume, it will create that compression and it will put that stress and strain on your vital organs. Okay, and it will lead to a lot many breathing difficulties and all, or even on your musculoskeletal system around your bones and all. So asthma, sleep apnea, obesity, hypoventilation, osteoarthritis, back pain, gout. Why these things are happening? Too much of fat, asthma, sleep apnea, hypoventilation. Why? Too much of fat around your lungs. Lungs are getting compressed. Not enough space for lungs to expand and relax. Okay, that's how you breathe. Your lungs expands and relaxes. That's how you can breathe in and breathe out. When there are too much of fat around your lungs, how will your lungs expand? Okay, so that leads to asthma, breathing issues and all. Osteoarthritis, back pain, gout around your, too much of fat around your skeletal system, okay, around your muscles, around your bone, and it causes inflammation. Okay. Next, coming to indirect effects. Obesity is also indirectly related with memory and cognition. Risk of Alzheimer's and dementia is high in obese people. Okay. Because again, inflammatory changes, inflammatory damages to your nervous system, to your neurons, to your brain, can lead to mental health issues. Female infertility, pregnancy complication is associated with obesity because hormonal level, things get messed up. Too much of male hormones, okay, suppression in the production of normal female hormones, that will lead to infertility and other complications. Depression, mood disorders, body image issues, social anxiety. Okay. Certain cancers like esophageal cancers, pancreatic cancer, common in obese people, breast cancer, colorectal cancer, uterine cancer, ovarian cancer in women. Okay. And what causes obesity? Fast and convenience food, depending on too much of fast food, convenience food, especially in communities and in families where you consume a lot of high processed fast and convenience food, that becomes your dietary staple. Both the parents, when they're working, they don't get enough time to make nutritious food at home, so they go for some vada paos or burgers or whatever is available on the way to the go. Okay. So they are high in sugar, fat, low in fiber, okay, low in other nutrients. And for that time being, you will feel full, but within few hours again, you will be hungry because they are not nutrient dense. And also they are addictive in nature. Okay. The ingredients that are used in fast foods, okay, that are addictive in natures. And sugar is in everything. In USA and all, if you see, even any packaged food that you take, refined sugar is definitely used. Okay, even if it is something savory, okay, like Lays or chips, potato chips, any snacks, savory snacks that you take, does not mean that it does not have sugar. It definitely has refined sugar. Sugar is in everything, everywhere. Okay. And sugar is also addictive in nature. So they use more amount of sugar to sell products, to push more products. Okay. And it does not have any nutritional value. It is just empty calories that you're taking. Then marketing and advertising. Uh, Persuasive advertisings are done. Okay. Using a lot of, for example, when you think about any fast food companies, okay, if you imagine a fast food company, the first thing that comes into your mind when it comes to the color of fast food company is always red, yellow, orange. Okay. These bright colors, they make you more hungry. Okay. Like if you eat food in a red plate, you will overeat. If you eat food in yellow or red plate, it will lead to overeating. If you eat food in a blue colored plate, you will not eat much. This is a scientific reason. Why? Because blue color is not naturally associated with food. Okay. You don't have much food in the nature that is blue in color. Okay. Even if you take blueberries, you say blueberries are blue in color. No, blueberries, they are not blue in color. They are purplish in color. Okay. So you don't have much food that is blue in color. Okay. Blue color in food, it does not look appetizing. Okay. So if you are on some weight loss journey, if you want to control your weight, start eating in small plates, especially which are blue in color. That will suppress your hunger more. You will not overeat. Okay. If you want to gain weight, people who are looking for gaining weight, start eating in red color plates. Okay. You will see that you are able to finish. Even if you have taken a little bit extra portion size, you will be able to finish that extra portion size. Okay. So red colored plates, red color will lead to overeating. Okay. It will push you into overeating, eating more food. Okay. So this is the trick of marketing and all. If you see the um, major fast food chains, okay, McDonald's, KFC, Domino's, Pizza Hut, okay, all these major fast food brands, they have this yellow, red. Even in Domino's, red color is used apart from the blue. Okay. Subway, green and yellow. Okay. So there are some tricks why they use these specific colors. You go to any food court, to any mall, any food court, and you just run your eyes through the names or the banners of uh, different fast foods available there. Majority you will find yellow, green, red. Red, mostly you will find red. Okay. When we think about Chinese food, if have you seen what color paint will they put on Chinese food stalls, street food stalls? Have you noticed it? What is the color of the paint they use in Chinese food stalls? Just when you go out for some street food nobbing and all, it is red colored. Red and white, red and yellow is mostly used to market Chinese food. Okay, Chinese food is also quite addictive. They use MSG and all. Okay, so it's quite addictive. So that's the marketing and advertising of fast food and how you fall into it and leads to overeating, obesity. The other psychological factors like boredom, loneliness. To overcome this, you will find your happiness with food. Okay, food also secretes dopamine. When you eat food, good food, it also secretes happy hormones in your mind. Okay, so when you're bored, low, or you're alone, you're anxious or depressed, your brain wants that happy hormones. Okay, and good food is one of the way through which your body feels good, feels happy, and it becomes a codependency on food. Okay, that leads to overeating. And then hormones also regulate your hunger and satiety. Hormones like leptin, ghrelin, and all. So, if there is an imbalance in these hormones, that could also lead to overeating. You do not know when to stop eating. Okay, if your satiety hormones are messed up, you don't know when to stop eating. Okay, that would lead to overeating. Lack of sleep, not having a circadian rhythm. Okay, late night scrolling. When you don't sleep by 11, definitely by 12 or by 1, you will feel hungry. You want to eat something. If when your sleep cycle has been disturbed, that also midnight snacking these days, it has been put into an eating disorder. Okay, midnight snacking or waking up at the night to eat something, midnight snacking as a behavior, it's an eating disorder. Okay, your body is not supposed to eat at night. Okay, so that's how hormones lead to obesity. Certain medications also like will lead you to gaining more weight, antidepressants, steroids, anti-seizure medications, diabetes medications, beta blockers. Beta blockers are used in hypertension, treating hypertension. Okay. Factors that may decrease how many calories we spend. Screen culture. This is how you're burning out your calories. Okay. Sitting while eating, if you're watching some series from some movies, watching some YouTube videos, or streaming online and eating, scrolling and eating, that will also lead to overeating. Okay. Since you spent a lot of time in front of your phones, computers, you don't have the energy to go out and uh, sweat a lot. Okay. So that leads to gaining weight. Then workforce changes. Now everyone is in front of their computers, everything is automated. Okay. So desk work is much more, and even for longer hours. Okay. 9-10 hours at a stretch you are at desk. Okay. Hardly 1 hour break you may get, only then you stand up, go here and there and come back. That is not enough. That much workout is not enough. So a lot of sedentary work has increased. Okay. Fatigue. Sedentary lifestyle has a snowball effect, means one will lead to another. Okay. So the longer you sit, the more tired, less motivated you become. Okay. Your body becomes very stiff. It also leads to aches, pains. Okay. Then the neighborhood design, that is the when you look around your society where you live, okay, where your residential places, do you have lot many parks there, or you don't have any social gathering setup? Okay. Earlier days, when we didn't had the smartphone culture, these parks, okay, were like really vibrant. By the evening time or early morning time, you see any parks around your area, it used to be very vibrant. Okay. People used to do their work at the evening time for their leisure. Okay. Families are out, children are playing. Okay. People are walking around. Okay. So that was a neighborhood design, but now these parks are not that filled with people. Okay. It's not that vibrant as how it used to be. So the more you live near any parks, any social gathering places, the more active you will be physically. Naturally, you will be more physically active. Okay, then you have the childcare trends which children are having their own PlayStation, Xbox, and all. Okay, at home they don't go out and play. Okay, and also on top of that, uh, the living condition of people in cities and all is such that you don't have any place for your child to run around and play. Okay. People live in matchbox kind of facilities in cities and all. So you don't have space for where your child can go out, get some sun and play. Okay. Then other disabilities, adults and children who have some learning and physical disabilities are at the higher risk of developing obesity because of their physical limitations. They don't have much areas where they can go study, okay, socialize, contribute to the society. Okay. That's how disability will lead to obesity. Management and treatment, making some dietary changes. So you have to personally check your weight and suit choose a weight that is suitable to you. Okay. And some people, just by cutting the portion sizes of snacks and meals, they are able to lose weight. You may be eating healthy. You are not eating that much of junk food. You are eating a regular healthy food. But if you just reduce a little bit of portion size, eat the same kind of food, but an altered portion size, more salads, more vegetables, less carbohydrates, more protein. Okay. Just cut the amount of carbohydrates that you eat. first and slowly then reduce the amount of oil that you use. That's it. That's the small basic change you can do. Okay. Cut off the snacks that you eat in between. And for some people, if you change how much you are eating, it is more than enough to lose weight. And eating more plants is beneficial to everyone. Okay, fruits, vegetables, whole grains, legumes, it's beneficial for everyone. They are low in fat, low in carbohydrates, high in fiber, good in micronutrients. They're nutritionally dense. Okay, and even after eating it, you are getting few calories. You feel more satisfied, full for a long time. Okay, so it will not lead to hunger pangs. Then increase your activity. Just walking 30 minutes a day for 5 days a week is also, you can, if you can do this much, is also enough. At moderate pace, brisk walking. Okay, walking at lunchtime and after work can also make a difference. It leads to uh, glucose uptake by your cells. After lunch and after dinner, if you walk for just 15 minutes. Okay. Then some behavioral therapies are available, like counseling, support groups for people who are dealing with obesity and body image issues. Okay, just because of the shame that is associated with having a certain body type. Okay, not able to wear what you want to wear. Okay, being bullied, being teased. Okay, so these all things can lead to social isolation, social anxiety. In such situation, counseling can help. Going to support groups, okay, food addictions and all, for that support groups are beneficial. Cognitive behavioral therapy can be used. So here in cognitive behavioral therapy, some tricks will be taught to you how to rewire your brain. Okay, as soon as, for example, some if you can use the rubber band technique, in which if you're craving for something rich, creamy, and something that is calorie dense, okay, you can start pulling the rubber strings at your hand. Okay, so it will do this rewiring for your brain, which will associate uh, unhealthy junk food with pain. Okay, so automatically you will stop craving for it. So these tricks can be used. Then certain medications which can help suppressing the hunger. Okay, appetite suppressants, and it can regulate your hormone. Okay, which can suppress either leptin, ghrelin, and all. So at a hormonal level, it will make some changes which will make you feel satiated, full, not hungry. Then weight loss surgeries are last option. You have to come under certain class of obesity when a weight loss surgery can be done. So especially if you have diagnosed with class 3 obesity, bariatric surgery, that is gastric bypass surgery and all, can be option for you. It is severe, but it is very effective. Okay. And it can give you significant weight loss, but you have to be very strict with your diet. You can't eat normal diet usually after it, because a portion of your stomach or intestine has been removed. So you will have to be taking some hydrolyzed nutrition and all, because majority of the enzymes, hydrochloric acid, these things will not be there in your body. Okay, so accordingly you have to shift your diet as well. So prevention for obesity, start with something small. Okay, everyone has a weight set point. Okay, I have explained this earlier as well. We have the set point theory. Okay, body weight set point theory. There is a specific weight below which you cannot lose weight. Okay, you may have successfully lost 5 to 6 kg in the past few months, but then arrives a time beyond which whatever exercise you do, how much of a diet you are doing, your body is not losing fat. That is a set point. Okay, because that is the weight your body is used to carrying around. Okay, so how can you push the set point even further low? You have to add more weight on you. Okay, not like putting on weight. Okay, you can wear ankle weights, body weights, put more resistance in your movements. So your body, you're tricking your body that your body is heavy. Yeah, just a minute. So, small set point theory, as I mentioned, when your body is right now at a biological weight set point and you are on a weight loss journey, you're not able to lose certain kilos. It means your body has reached the set point. So, if you want to push that set point, add more body weights, add more resistance in your movements. Okay, you're tricking your body that your body is heavy. It is working out, so it has to lose weight. Okay, so make some small sacrifices. Just 150 extra calories a day can just add 10 extra pounds in a year. Okay, that is overeating. Okay, so remove all the snacks. Don't buy snacks at all. Okay, so when it is not there at your home, you will not munch on it, you will not eat. Okay, add small activities. For example, if you're eating on dining tables, start eating sitting on the ground, on the floor, because when you sit down, get up at least 6 times a day, when you are sitting down, getting up, eating 3 meals. Okay, that is giving more movement in your body as compared to just pulling the chair out and sitting. Okay, if possible, remove the bed and use only the mattress. Okay, remove the chairs and tables, and you try to sit on the floor as much as possible. Okay, and while doing your work, even whenever you want to get up, it means you're getting up from the floor, you're standing up from the floor. Okay, so in which your ankles, your joints will have that regular motion. Okay, even unknowingly you are exercising. You may think that you're doing your regular chores at home, you're just doing the regular routine work, but these small changes, it is enabling you to be more active. Okay, shop intentionally, stock only healthy food, don't stock any savory fast food. Okay, so even if you feel like you want to snack on something, the only options that you have are healthy options. Okay, so cultivate overall wellness, reduce your screen time, no screen time before bed, otherwise your circadian rhythm will be affected. Okay, go outside as much, go out for a walk whenever you get a chance. So these can be the prevention strategies. So that's about obesity. Is it clear to all?